According to the Centers for Disease Control and Prevention, approximately 25% of adults over the age of 65 have no natural teeth. While tooth loss is just one aspect of oral health, it underscores the importance of proper oral care in aging well and maintaining overall well-being. Welcome to Aging Together, a podcast dedicated to exploring the challenges and opportunities of caring for our aging loved ones. This podcast is a product of Caregiver Consulting and Healthy Solutions, a private consulting practice dedicated to helping you navigate the aging process with ease. Together, we will dive into a wide range of topics, including health and wellness, financial planning, caregiving, and more. This podcast is for everyone, whether you are an older adult looking to age in place, a caregiver seeking support and guidance, a young or middle-aged adult planning for the future, or simply someone interested in learning more about the aging process. I hope you'll join me on this journey. Let's navigate aging together. What's up, everyone? I'm your host, Pooja, and you're listening to Aging Together. October is Dental Hygiene Month. As an occupational therapist in the hospital, I sometimes saw patients admitted due to infections or injuries related to oral health. We also spend a fair deal of our time as occupational therapists in the hospital advocating for patients to receive daily oral hygiene to help prevent hospital-acquired infections. For today's episode, I have the pleasure of interviewing Dr. Krupa Patel, a general dentist. Dr. Krupa Patel graduated from Marquette University School of Dentistry in 2017. She has been practicing in Illinois for over 4 years and has joined the Alpine Creek Dental team in 2021. Her goal is to provide high-quality dental care while educating her patients on the importance of good oral health. Dr. Krupa Patel's mission is to provide her patients with a comprehensive dental care with the highest standards. Her practice is dedicated to providing your family with quality care by assuring that each patient receives individual attention. She strives to build meaningful long-term relationships with her patients based on trust and mutual respect. Together, we're taking a dive into everything you need to know about the role of oral health and hygiene in aging well. Please join me in welcoming Dr. Krupa Patel to the show. Krupa, thank you so much for joining me today.
Hello, I'm so happy to be here. Thanks for having me.
You are so welcome. I gave a brief intro bio about you already, but let's start with a brief introduction. Go ahead and introduce yourself.
Sure thing. So I'm a general dentist. I've been practicing now for almost 6 years, which is so crazy how time flies. But currently I'm in private practice here in Illinois. It's a practice called Alpine Creek Dental. I went to Marquette for my undergraduate studies. I did biomedical sciences there. And then I actually went to Marquette for dental school as well. Moved back to the Chicagoland area because that's where my family is. Yeah, and now I practice here in Elmhurst. One thing I love about general dentistry is that is very different every single day. I'm able to practice a variety of procedures for people of all ages. So yeah, I see children as small as 1 to 2 years old, and then all the way up to our elderly population.
That's awesome. What a great range of populations to work with.
Yeah, it's pretty amazing.
So to start, can you explain what oral health encompasses and why it's important for overall well-being, especially as people get older?
So oral health is, the well-being of your mouth, including your teeth, your gums, your tongue, your lips, and all of its supporting structures involves a whole lot more than obviously just your teeth and gums. It includes your airway. Dental hygiene is very important as well. Going to see your dentist regularly, eating a healthy diet, gum health, and preventative care are very important. When you hear about the oral cavity being the gateway to the rest of your body, that really is true. The same bacteria that can cause gum disease and periodontal disease can actually travel. It can worsen heart disease and diabetes. So it's very important for you to be going in and seeing your dentist every 6 months and getting everything checked out.
I know there's quite a few different types of oral health providers. For example, like there's dental hygienists or dentists versus orthodontists versus endodontists. Can you briefly explain the difference between all these different providers and when you might need one or the other?
Sure. So the dentists that you routinely see every 6 months, they're the ones who are going to diagnose and treat a wide range of dental and oral health issues. They do your routine checkups, your cleanings, your fillings, extractions, and various other treatments like crowns, bridges, root canals. Some dentists even specialize in specific areas like orthodontics, so some will even place braces or do clear aligner therapy. A lot of dentists will also perform a variety of oral surgeries, ranging from tooth extractions to placing implants. It all just kind of depends on how much your general dentist is pursuing doing continuing education after their years in dental school. Sky's the limit for a general dentist. Orthodontist is a specialist. They do 3 years of training after going to dental school, and they're the ones placing braces, doing Invisalign and correct issues like crowded teeth, overbites, underbites. Periodontist is a gum specialist. So periodontist is going to be doing surgeries within your gums. They'll diagnose and treat gum disease through a variety of different procedures. They can do gum grafts and they can also place implants. Endodontist specializes in treating the pulp of the tooth, so the nerve inside your tooth. They perform root canal therapies and deal with dental emergencies that damage the inside nerve of your tooth. Oral and maxillofacial surgeons, they're trained to perform surgical procedures to the mouth, jaw, and face. This not only includes tooth extractions, but also jaw and facial trauma surgery. Usually you'll see an oral surgeon if you're getting your wisdom teeth out, but if you were unfortunately in a bad accident and you needed, reconstruction, you would see an oral maxillofacial surgeon. And that requires, after dental school, the surgeon actually goes to medical school and does further training. So,
holy crap.
Yep. Yeah. They do almost 5 or 6 years after dental school. They do a lot. Pediatric dentists, they will see children. So they're going to focus on adolescents and children. They'll specialize in, they're going to be doing your cleanings, your fillings, extractions, but they just are more specialized to treat the little ones. Prosthodontists will specialize in restoring and replacing missing teeth. So let's say, you have an elder patient that needs dentures. Prosthodontists are going to be very well trained to do that, and they can restore many, many missing teeth. Oh, dental hygienist. Dental hygienist, that's the person that you're going to see, you'll probably have a very close relationship with because you'll see the dental hygienist every 6 months for your cleaning, or we don't really call them cleanings, they're prophylaxis. But yes, so you will be seeing them every 6 months for that. They'll take x-rays and they'll educate you on dental hygiene and how to routinely take care of your teeth and gums. Dental assistant is usually someone who is usually working with the dentist, helping them on procedures that they're performing.
I don't think I realized how many different providers are within dentistry.
Oh, yeah. Yeah. There's just so much, there's so many different fields. In every area, there's a specialty. So it's pretty awesome.
Why is oral health so important? We always tell people, okay, go to your cleanings, do this, do that, brush your teeth twice a day. Can you talk a little bit about what are some common oral health issues that older adults may face? How can these impact their quality of life? And similarly, how does oral health relate to overall health in aging individuals? Are there any systemic health conditions that can be linked to poor oral health, and kind of why is it so important?
Sure. So as we get older, we do become more susceptible to oral health issues because of lifestyle changes, health conditions that can affect your oral health. Tooth decay is more common in elderly patients who are on multiple medications because certain medications can cause dry mouth. Certain medications can also cause changes in your gum tissue. For example, gingival hyperplasia can occur, where your gums become larger and more sensitive to bleeding and things like that. Gum disease becomes more prevalent when you're older. You can get recession, bleeding, tooth loss. When you do get recession, the root of the tooth is more exposed. And because of that, you're more susceptible to getting root cavities. Oral cancer risk increases with age, and seeing your dentist every 6 months is important because we'll always do an oral cancer screening to detect that early on. Elderly patients who've lost teeth over time or maybe don't have any of their teeth, a lot of times they're wearing dentures, which can have issues with fit and comfort as you age. As we get older, we actually lose the bone that supports those dentures, so they can become problematic. As they get older, they can start getting loose, and it affects how you eat and chew. So yeah, chronic health conditions like diabetes and heart disease, those are also connected to your oral health. And older adults may have multiple health conditions that affect their oral health.
What are some key preventative measures and habits that older adults should adopt to maintain good oral health as they age?
So to promote better oral health in the older population, it's crucial for individuals, and maybe even their caregivers to take the preventative measures. So going in for your regular dental checkups, maintaining a good oral hygiene at home, and addressing dry mouth issues and adapting to the changing, oral health conditions that come with age. Dentists and dental hygienists can provide guidance and treatment to address these common oral health conditions and concerns in the elderly population.
Thanks for sharing all those facts. And now that you've provided so many good facts, what are some key myths related to oral health and dentistry? I'm thinking I've definitely heard people say, well, you only need to go to the dentist if something hurts. And we obviously know that that's not true, but there's definitely a lot of other myths like that too, of when you should or shouldn't go to the dentist, but also things related to your oral health. So what are some things you've heard in your line of work?
Oh gosh, there's so many. I don't know how I can narrow it down. But there's so many myths out there. I mean, one common one is that sugar is the only factor that causes cavities. I mean, sugar plays a huge role because obviously bacteria likes sugar, and the more sugar you have in between your teeth, more bacteria, and that's what causes cavities. But it's so much more than that. It's also what medications you're on. It's if you're not, doing proper oral hygiene, then that's also going to be what's causing your cavities. So it's more than that. Flossing is unnecessary. A lot of people don't believe in flossing. And I know it's like I'm a broken record sometimes, but it really, truly is important, guys. I mean, it's the key for a healthy mouth. I mean, it physically removing the plaque and bacteria between your teeth, you're preventing cavities, and you're also protecting your gum tissue. And without doing that, if you're not doing that on a regular basis, you're more likely to get cavities and you're more likely to have gum disease. It's facts. But yeah, people have a hard time believing that. Another one, let's see. Baby teeth don't matter because they will fall out eventually. I get this a lot. Sometimes parents will come in and their kids will have cavities on their teeth, and they're like, well, it's a baby tooth. We can just wait for it to come out. And, cavity is essentially an infection inside the tooth. So if you're waiting for that tooth to shed itself, in the meantime, it acts just like an adult tooth. So the bacteria can get to the nerve of the tooth and cause an abscess. And if it causes an abscess, your child can get swollen, and that can lead to something very, very serious. So even though it's a baby tooth, whatever is happening with it needs to be addressed right away. Whether it's a baby root canal, which we call pulpotomy, we can do those to save baby teeth, or they may need to be removed. And if the baby tooth has to be removed, it's important for the child to have a space maintainer, because we may be removing that tooth ahead of when it needs to go. So we have to maintain that space in the child's mouth so that they're still growing appropriately. There is another myth about fluoride. Lots of people think different things about fluoride, that fluoride's bad for your health and you can't consume a lot of it because it's toxic. That is false. Fluoride is the only known mineral that we know is going to help heal your tooth structure. So if you have a cavity that's starting to form, the only way to treat it is through fluoride. So yeah, fluoride is very important. Make sure that you have that in your toothpaste. I know there are a lot of healthy toothpastes out there in the market, but are, I guess, organic toothpaste that don't contain fluoride. I personally, I don't recommend those. So yeah, dental x-rays provide harmful radiation. So that's another myth. We actually get radiation by just walking outside. So a simple x-ray isn't going to cause that much harm. And with technology that we have today, it's such a tiny amount of radiation that you can get from an x-ray. And I understand if there is some concern behind it for doing too many of them, but it's a very small amount of radiation. You honestly get more from going on an airplane or even eating a banana or using your cell phone. So yeah, that's a common myth for sure.
These are probably the same people who sleep with their phone right next to them.
Yeah, exactly.
How much radiation that transmits.
Right. Yeah. When you're just sleeping on your cell phone. Exactly. Another one that, people may not be aware of is avoiding dental care when you're pregnant. Going to the dentist when you're pregnant is actually crucial because through pregnancy, your hormones are changing, and that can actually increase the risk of gum disease. So going in for your regular checkups and cleanings is very important, even during pregnancy. And sometimes, depending on what trimester you're on, we can avoid taking x-rays or, even postpone procedures that we want to do till after pregnancy. But for the most part, if you have infection and you're pregnant, that needs to be treated right away. We should not wait till after your pregnancy to come in.
I think a big part of that is not understanding that an infection in your mouth can spread to your body, right? And you don't want that during pregnancy, but I think there's just a lack of awareness of understanding that can happen.
Oh, yeah, absolutely. It can, an infection in the mouth can easily spread everywhere else. Bacteria can get into the bloodstream and cause an even bigger problem. So definitely sepsis, for example, which we don't want. So.
I think going through these myths already kind of answers this next question I have for you. But why is it so important that we educate and encourage older adults and adults about the importance of routine dental checks, good oral hygiene? What role do regular dental checkups play in ensuring good oral health as people get older? And how often should older adults see a dentist? What are some of the risks or costs associated with neglecting or avoiding seeing the dentist?
So, it's important that we educate, and encourage adults to just come in, proactively at least twice a year for their dental checkups. Routine dental checkups are a proactive approach to maintaining, good oral health and addressing any issues right away, because some of those issues can contribute to their quality of life and their overall health, especially in the later years. They should be seeing their hygienist twice a year for a checkup, and both of those times you will see a dentist as well. Depending on how their gingival tissues are, some elderly patients may actually need to come in up to 4 times a year or even more. And that's to maintain if they have gum disease, it's to maintain the gum disease so that it doesn't reoccur. It's important to be addressing those issues promptly. Cavities, gum disease, tooth sensitivity, denture maintenance, early detection of oral cancer. So the oral cancer is super important because if you're going in every 6 months to see your dentist, they're going to be doing an oral cancer screening. And as you get older, that's more prevalent. Oral cancer is more prevalent as you age. So your dentist is going to check all your soft tissues. And if there is anything suspicious, they're able to detect those things. And it's important to detect it earlier on for sure.
I feel like a broken record, but this is a common theme across all 40 of our episodes so far, where we really need to highlight and educate the population about early detection, early intervention, and then proactive and preventative care.
Absolutely. Yeah.
And it doesn't matter what part of your body. It's for every sort of function you can think of throughout your body that will lead to better health and long-term outcomes for health.
And better quality of life. Yeah.
Yeah. I spoke with a dietitian back in March on episode 9, and we talked about how nutrition impacts aging. Can you discuss the connection between oral health and nutrition in older adults, and how does the condition of one's mouth affect their ability to eat a balanced diet?
Oh yeah, absolutely. So I worked at Aspen Dental, and many of you may have heard of Aspen Dental. But it's a corporate dental office, and they are kind of all over. But when I did work for them when I first graduated from dental school, and I was in more of a remote area where the population that I treated were mostly older adults who were in dentures and partials. Patients who don't have all of their teeth. But if these dentures and these partials were not fitting well, it truly, truly affects how you eat and how you taste food. They're just not fun things to wear. And we see a lot of elderly patients who wear them. So it really affects how they eat, how they chew, how they speak, the type of food they can eat. When patients are first getting into their first set of dentures, they really have to cut up the food that they're trying to eat because they can't eat it the way that they used to. You can't just bite into an apple anymore. You have to cut that up. There are certain types of meats and proteins that require more chewing. That's just simply harder to do without your natural teeth. So yeah, that's why, again, it's so important to be going in and seeing your dentist and, trying to save your natural teeth, because they are going to do the best function for you. Unfortunately, dentures and partials are not it. We work really hard on trying to get the best fit as possible for patients, but at the end of the day, they can't replace your natural teeth. So
I love that you mentioned the problems with ill-fitting dentures, because I remember it also impacts communication.
Oh, yeah. Huge. You can't speak properly.
Yeah. I remember my grandma had really poor dentures one time, and, so she would remove them because they were uncomfortable.
Yeah.
And she would only put them on for meals. And so we really couldn't understand her most of the day because she tried to talk without her dentures on. And it's really difficult to communicate like that.
Yeah. Yeah, you don't think about it, but your front two teeth are not just important for your smile. They're important for eating and chewing, speaking. That's what helps make those sounds that are so important, that the phonetics behind everything, Right. So yeah, and it's hard with dentures, especially if they're moving around. A lot of elderly patients use like a polygrip to try denture adhesive to try and keep them in, but that's not always the cleanest. And
that's a fun activity for people to try. Like, focus on how many times your tongue touches your top teeth when you're talking, and then try and do it without touching them.
Yeah. It will be difficult. Those F sounds, those S sounds are very hard to make without those teeth. So yeah, absolutely.
Moving on to more so like medications. I know you mentioned this earlier, that the types of medications you're on can impact your oral health and your gums and stuff. Does medication, especially for chronic conditions that are common in older adults, affect oral health from a bigger standpoint? And are there any interactions or side effects that people should be aware of?
Yes. So there are medications out there, many, many medications that can actually cause dry mouth. It is important if you are on medication for high blood pressure or cholesterol or one of these health conditions, that you look up what these side effects are. Of course, you have to be taking these, but they can cause dry mouth, which in turn can cause more cavities in your mouth. So that's one for sure. Some of them, like anxiety medications, things like that, can also cause gingival hyperplasia, which is where your gum tissues swell up. If you do have this condition, you may need to see your your hygienist a little bit more often, maybe 4 times a year versus twice a year for your cleanings. There are other medications that treat osteoporosis, which is very common in women, especially elderly women, and they have to take bisphosphonates. Bisphosphonates are important for your dentist to know whether or not you are on, because if you, let's say, are in need of a dental extraction or some type of dental surgery, it's important for you to actually be off of the bisphosphonates because they can cause a very serious condition called osteonecrosis of the jaw. So giving your dentist your full medication list is so important because there are these interactions that can happen. Some elderly patients who are on antibiotics that can change the oral bacteria in your mouth, and that can cause oral thrush. So a lot of different candidiasis, different things that we notice as dentists. So yeah, give your dentist all your medication list, please. It's important for them to know what's going on as far as your entire health condition.
Okay, moving into more like modern day stuff. Are there any technologies or advancements in dental care that have made it easier for older adults to maintain good oral health?
Yes, absolutely. So maintaining good oral health requires, for normal individuals, brushing your teeth twice a day, using some type of fluoride rinse, and also flossing, right? So there are technological advancements that make it easier for older adults to do that efficiently. One is using an electric toothbrush. Oral-B and Sonicare have one of the best ones on the market. Either one, it doesn't even have to be one of those. It doesn't have to be super expensive, but an electric toothbrush is going to be way more effective and efficient for removing the plaque and bacteria from your teeth versus using your hands. That goes for people of all ages, children as well. They aren't able to effectively remove it just with their hand. A lot of these newer toothbrushes also have timers, so you know that you're doing it for the full 2 minutes. It even breaks it down into sections. It really is dummy proof. It's pretty awesome. And then as far as flossing, if older patients don't have the manual dexterity to get into between the teeth with the floss, the normal threaded floss, using a water flosser or water pick is a really awesome addition as well. They have units that sit on your sink. They also have handheld units now that you can actually take into the shower. There is no excuse for not doing it because you can essentially take this into the shower, fill it up, and do it while you're showering.
And make all the mess you want.
Make all the mess you want in the shower. Yeah. Don't have to, get it all over your countertops or anything like that. But yeah, I recommend the water pick to all of my patients who have gum disease, especially because it's just, actually there are studies out there that it's very effective in patients in gum disease because it goes deeper into the gingival tissues. So your floss, your regular threaded floss, will go about 2 millimeters into the gingival tissues. A water pick or a water flosser can go up to 5.
Oh, wow.
Yes. And a lot of patients who have gum disease have like 5, 6, 7 millimeter pockets that regular flossing is just not going to be as effective on its own. So using the regular floss, but also a water pick and a water flosser is going to be way more beneficial for them.
That's really good information. I think even for adults to know, if you're somebody who doesn't like to floss like me, I think it's really good to know that there are these other options they're still messy, but you can do them in ways that make it less messy.
Yeah, absolutely. There's so many different ways to do it now. So that's the nice part about it. Technology is always improving.
So the OT in me has to ask you this.
Absolutely.
So sometimes older adults may have other hurdles that are preventing them from accessing proper healthcare or proper oral hygiene. So things like cost, transportation, mobility issues. What are some ways that older adults can overcome some of these barriers to just even accessing basic dental care or oral hygiene?
That's a tough one. That's a really tough one. As far as cost, I mean, I know there are many dental offices that do take Medicaid or Medicare to provide the care that they need. Transportation, yeah, that's tough. I mean, I would assume like if there are elder patients in like nursing homes, I do have patients who come from nursing homes that they would provide transportation for them and, to and back. Usually they come with caretakers as well to help get them to the office. And then they also kind of help talk to the patients and explain why we're doing what we're doing. But it is tough. It's not easy. Mobility issues, as far as, do you mean like if they're having trouble with manual dexterity and actually performing the dental tasks? Is that kind of...
No, I'm kind of thinking of people who maybe like they're in wheelchairs or they need a lot of help to get around, and trying to get into those dental chairs can sometimes be difficult.
Yes.
And so are there ways that you guys work around even just the physical act of being in a dental chair?
I got you. So we'll actually treat patients in their chairs.
Oh, good to know.
Yeah. So if that's needed, I've done that. We've performed cleanings and basic dental hygiene care while they're in their dental chairs. If we do need to do procedures, then of course we would transfer them, and we have safe ways of transferring them into our dental chair to help them. So every office is built different. Some offices have bigger rooms where they're able to do that. We just have to, really know about the patient that's coming in and learn about what's going on in order to help them in the best way possible. So that's what we try and do, right?
So just to clarify, you said you will see patients in their wheelchairs if necessary.
Absolutely. Yep.
That's good to know. I think a lot of times there's self-perceived notions that, I'm not going to be able to do this, so I'm just not going to go. And I think it's important for people to know and understand that most healthcare practices, regardless of what practice it is, they will do whatever they can to help the individual.
Yes, that's 100%. We will try to help whoever comes in to see us, right? So we'll find a way. And if it's seeing them in their own wheelchair, that's what we do.
Along similar lines, some older adults may have family members or other caregivers assisting them with their oral care, especially not only if they don't have the dexterity, but even if, sometimes patients after a stroke might not be able to use an arm at all, or if they have a spinal cord injury, they might not have even any mobility of their upper body. And so they have other people helping them with this. Can you provide some tips or strategies for caregivers or family members who are assisting older adults with their oral care routine? Like, what's important? What's like the main things they should make sure they're doing when they're providing oral care
for their... Yeah. It's trying your best, and I know it's not always easy, but trying your best to get in there to help your family member brush their teeth and floss. Those two things. Trying to get in there and debride the plaque and bacteria that's sitting on the patient's teeth and gums at least twice a day. And sometimes it's not the easiest task, and I can understand that, but that is so crucial. I see patients who are autistic and their parents are helping them, even if in their old age, they're helping their autistic children, maintain their oral health. And that's one of the key things, is to really get in there. And it's not easy, and I know that, but get in there and really try and debride that plaque and bacteria. Again, using an electric toothbrush is going to really help versus a regular toothbrush to help remove that plaque and bacteria. And coming in and bringing them to see us, because we will see them.
Yeah, that's a good point. Moving back to kind of the overall health factor for oral health, are there other healthcare providers or professionals that you, as the dentist, will collaborate with if necessary for any adult?
Yes, absolutely. So knowing your patient's medical history is really important, especially with the elderly population who may have more health conditions. So, I would talk to a patient's physician about what medications they're on, especially if the patient doesn't know all of the medications. We'll reach out to them and find out the entire list of medications that they're on so that we know that we're providing them the best care possible. One of the main things is if the patient is in need of getting a dental extraction, their medication list is very important. So sometimes you would need clearance from the medical doctor or the physician, like a cardiac clearance, or depending on how they are. So yeah, if they have osteoporosis and they're on bisphosphonates, that's something important. If they have diabetes, we would really need to know, what their status is and what their blood sugar levels are, so that if we are going to be providing some of the services, that we're doing it in the safest way possible. Yeah, we definitely talk to the physicians a lot before we move forward with surgeries and things like that.
I think another big one is blood thinners.
Oh yes, blood thinners, absolutely.
When people are on blood thinners, I think in most cases, people who are taking blood thinners are aware that they, of course, need to stop taking them before a surgical procedure. But there's different parameters around when to stop them, when to start them again,
Yep.
how long you need to be off of them in order to proceed, depending on the type of surgery.
Yep.
And I think that's where it's really important that the teams are communicating, not just with the patient, but with each other to make sure that the patient's as safe as possible.
Yep, absolutely. Different types of blood thinners will have different protocols. So yeah, that's when we would talk to your physician and find out what you need exactly.
Well, this has been an excellent conversation. I think you'd be excited to hear that as occupational therapy practitioners, especially in the hospital, we place a huge, huge emphasis on oral health, especially because that's often one of the last things on people's minds when they're in the hospital is brushing their teeth. And you'd be surprised how many times I'll walk into a room and be like, have you brushed your teeth today? And it's like 3 p.m. and they're like, no, nobody's helped me.
Right.
Or I wasn't allowed to get out of bed, or I couldn't make it to the bathroom. And you're like, okay, let's brush your teeth,
right.
And one of the biggest reasons we give people is because it decreases the risk of pneumonia in the hospital, right? Because that's such an easy place for bacteria to gather, and it goes straight down your digestive and respiratory system. And it's such a high,
it's a big risk.
Yeah, it's a big risk. And so we do prioritize that, at least in the hospital.
I'm so happy to hear that.
Overall, what would you say is your one big takeaway that you'd like the audience to consider as it relates to oral health and aging?
So one big takeaway is honestly just maintaining good oral health, good oral hygiene is essential for your well-being and for your quality of life, especially in the older population. As individuals age, they become more susceptible to different types of oral health issues, cavities, gum disease, dry mouth because of the medications you're taking, and if gum disease is uncontrolled, it can lead to tooth loss. So addressing these issues ahead of time is key. The preventive measures are so important because if they're not taken seriously ahead of time, and if you do lose teeth, then, it affects the way the individual eats, how they speak, and even how they maintain proper nutrition in their day-to-day life. So yeah, it's important to understand that oral health is not just, about your teeth and your gums, but it truly affects your whole body.
That's a great takeaway. Thank you, Krupa, so much for joining me today and speaking about the importance of oral health for our aging population.
Of course. Thanks for having me, Pooja.
To all my listeners, thank you for tuning into this week's episode on oral health and its importance in aging well. Sharing expert perspectives on various age-related topics and services can help the community learn how to plan for a healthier future. At Caregiver Consulting and Healthy Solutions, we are dedicated to helping you navigate aging together. Thanks for tuning in, and I'll see you next time.